Kimberly said that she wanted to do this demo. She's been wanting to do this for a long time. She keeps saying, Adrian, we've really got to show this stuff next webinar, and I keep putting it off. Well, next webinar is here, and we're going to do it. So the first thing she did was tell me to take my shoe off, and then she pulled out a marker and started writing on my ankle. And so I don't know what's going to happen next. Kimberly,
Okay.
take it away. Show us what you want.
So when we are at a show, I will have people come to me who said, I bought my AcuGraph, I'm really excited, I really love it, but I'm not super comfortable. Can you help me out with the graphing portion? And so I am going to pretend that everyone who's in our webinar is sitting down with me at a show, and I'm going to teach them what I teach to other practitioners. I really feel like point location, people when they are graphing, if I were just going to start a graph,
Left, long 9.
well, first, let's put this in your hand. We did have somebody call yesterday, and we had several questions back and forth, and she said her probe was just not working. And Jenny, bless her heart, she kept troubleshooting and checking. And two things that people forget to do if they're new.
Oh no, here it comes.
One, you have to wet the cotton ball with water. Wet
You have
the
to
cotton
have
ball.
a cotton ball.
Correct. You have to
Yeah.
have the Q-tip in. You have to wet it with water.
Yeah.
And then dip it on the pad. That's the first thing. So we can have that. The other thing is, if he's not holding this probe, and let's just say I leave the probe to the side, if I tried to graph him, you would think that the probe is not working.
Yeah, nothing's going to happen.
What needs to happen is the probe needs to be in his hand.
Look at that.
And then it works.
So hold the probe.
Voila.
Got it.
So if you're graphing yourself, there's a couple tricky little things that you could do if you're just wanting to practice and graph on yourself. You could take this probe, and if you're wanting to use two hands, you can actually put it like right in the hip, right in your hip. If as long as it's touching your skin, put it right in your hip and you're holding it. Also, another little thing I like to teach people, if you're graphing a baby's not going to hold this really well for you. I just pop it into the side of the diaper. Not the front.
Delightful.
Not the front, not the back, just to the side of the diaper, and then I've got my two hands and I'm done with the baby.
I'd still disinfect it. I've had babies.
I know,
I
but
know.
clean babies. So
Okay.
the couple little tips.
Got it.
So having said that, the thing that I like to teach practitioners is about point location. By the time you own AcuGraph, you know your point location. Obviously, it tells you on the computer screen where you're going to graph, but you know yourself from years of treating, and a lot of people will just go right in and go, well, did I get it? And they're looking and they're listening for the highest sound, which we teach you to do that. That is good. But I feel like practitioners do better if they will take their finger and they will feel for where the point is.
Okay, I get asked this one a lot, Kimberly, so address this. Sorry.
That's okay.
It's just that people say, what, you mean I can touch the patient before I measure? Won't that throw the measurement off? And the answer is, no, it won't. Touching the patient isn't going to change the electrical properties of the point much. And once you go in there with the electricity, you'll get the electrical measurement. So palpating is fine as long as you're not, grinding the point.
Right, and I mean, it's as if you were going to take lung 9 and you were going to put a needle in it. You would feel for where you were going to put that needle. So feel for the points. So these points are really easy to find, obviously, on the wrist. Just feel for the point. Once I feel for the point, then I go in and I take
Left,
the measurement.
Pericardium 7.
So I wasn't taking
Left,
the right
long
measurement.
9.
So then the other thing I want to talk about point location, so feeling for it first, and then there's a few points that I feel like you can get a better point location if you understand a little more of the anatomy. So let's talk about small intestine 4. Small intestine 4, it's falling right into this space right here. So small intestine 1, 2, 3, 4.
So you're coming right along this bone right here, right along the carpal, and as you drop in there, the metacarpal, as you drop in there, then you're going to feel that little
There's a
divot.
spot where if you closed your eyes and you allowed your finger to fall in, that is where small intestine 4 is. So that is small intestine 4. Sanjiao 4, if you get the patient to relax their hand a little bit, I guess, do we call it triple energizer 4?
Yeah.
There's a tendon right here, and as you loosen up the hand, the tendon, we want to be on the lateral side of the tendon. So,
And if you're looking for the tendon, if they flex, or excuse me, they extend the wrist, then that tendon stands up and you can feel it stand
right, and
up.
my patients have learned over the time, I get them to relax and I feel in
You
with
feel
my
the tendon,
thumb,
sure.
and I feel where I want to go, and then I go into the point and I find it. So Sanjiao, and then large intestine 4. Large intestine 4, you'll have varying definitions.
I've seen it all over the place,
I
depending on
really
who you
have.
talk to.
The one that I find that is the most electrically active and where my finger knows to go, if you take the metacarpal bone, am I
Mhm.
using the right word? Okay, metacarpal bone, right along this bone, you feel the whole bone halfway along the bone, and then you're running your finger and you're finding that spot where it sticks. It literally is halfway. It's not in this triangle in the center. It is next to the bone.
So it's on the bone, it's not here, it's here.
Yes, it's to the side, and it's to the side. I mean, you're not coming on top of the bone, you're coming to the side.
From the side, yeah.
Mhm. And if you run your finger, go ahead and run your finger.
Oh, I feel it, and
Yeah.
I feel you hitting it, and it's funny because right there you hit a tender spot right as you hit it.
Right, and so just trust your fingers. So those are the hand points that I wanted to talk about.
One thing while you're getting the foot points out, tell me about the role of searching electrically, because you can feel the anatomy, you can feel the spot it's supposed to be, but you could be a couple millimeters either way and still be in the anatomical area.
You can, and so if I were doing this, I would search it with my finger first.
Mhm.
That's kind of the zone where I'm going to go in. And then I'm going to find my highest sound
Left,
right in that little
pericardium
bit
7.
of the area. So I've already done most of the work by letting my finger find the point. Because if the whole time and you haven't found it and you're doing all this searching,
Left,
by the time you
part 7.
actually found it, if you look on the screen, you can see this up and down, up and down.
Right.
That's another key indicator that maybe you should try again if on the screen it looks very choppy.
Yeah, and if you need more time,
So now watch the screen. Let's do that one again. I am finding the point,
okay,
and now, and I'm going in, and you'll notice how the screen
Left,
narrows
small
out.
intestine
When
4.
it's narrowed out, and how many
Plateaued.
seconds is it reading? What is the in
within
the
a-
point?
well, it reads 3 seconds by default, but you can change that time. If you
Okay.
feel like you need 5 seconds, you can change that in the settings.
Okay, yeah, and I think I keep mine at 3 seconds. Okay, so then there are a couple of points. I mean, you know how to find spleen, you know how to find liver, kidney. I think most people are pretty good at finding kidney. You want to find the medial malleolus and then the Achilles tendon, and it's literally between the two. And so as I'm going into feeling, it's
Just
sort of the
drops right in
halfway,
there.
and it drops right in. That one's
Yeah.
an easy one. Gallbladder 40,
This is where you wrote on
This
me.
is where I wrote on you. So gallbladder 40, if you take the lateral malleolus and you draw a line coming down, and then you draw a line coming under, where these two cross, and right inside that crossing zone, that is where you're going to find the point. This point is a little bit tricky. It's deeper. It's not as surface, and sometimes when I'm finding this point, I need to go in a little bit deeper. I'm feeling for it first. That's the first thing that I do, and my patients usually are like, "Oh yeah, you found it." And then I'm going in a little bit deeper. Sometimes I have
Left,
to change my
triple
angle.
Energizer 4.
Sometimes I have to change my angle slightly in order to actually get it, but I will change my angle slightly, get that highest sound. So there's not a lot of sliding. Once you find that point, you get in, and it's a slight angle difference.
So then you're kind of, you're going a little deep with it. Not pushing hard, but just sensing where inside there it is.
Exactly. So that is how I find gallbladder 40. Now, bladder 64. We've had a lot of discussions, even if you watch any of our live training, when we've had Jake Fratkin here, we've had discussions on the location of bladder 64. So, if you go back to your points class, you got bladder 67, 66, 65, 64. When you are letting your finger slide, you're sliding up to this junction right here. There's a ball junction. You are on the anterior side of the junction. Am I using the right
Yeah, so
terminology?
you're on the metatarsal, and you're at the metatarsal head on the shaft of the metatarsal, where the shaft meets the head.
Right. So, again, it's one of those ones, you know, if you have somebody who has a really chunky foot, you need to take a moment and you need to feel and palpate and find that place where your finger sticks. Adrian doesn't have a chunky foot, which makes his very easy to find. But sometimes just take a minute and slide your finger. You'll find that spot where it hits. Once you've found the spot where it hits, then you can go in, and it's easy. There's not a lot of
Left,
sliding around
large
because you've
intestine
already
4.
slid into the space.
And it's at the junction of the light and dark skin, where the two skin types meet.
Right. You don't have a lot of
Not
light
a,
dark.
yeah, no, I'm
Not a lot of
as
light and dark
pasty as
skin.
they come.
Stomach 41.
42.
40
Oh, well, 42 is where you're
40
going.
42 is where I'm going, correct. Sorry. This one here, you got to find that place that's comfortable. Where I would needle this point, I actually find the stomach 44 cleavage line. So here's the cleavage line of stomach 44, and then I run my finger upward, and I find this place on the highest top of the mount where it sticks. And here's stomach 41 between the tendons, and it's sort of in this line.
So it's pretty close to the liver channel.
It is
There's
pretty
not
close.
a lot of separation there.
And I find where, I mean, you really will do best if you find where your finger hits and it falls into it, and then notice the sound, how it shifted ever
And
so slightly.
I'll tell you, by the way, that it's my experience, this is one I have to search for electrically a little more. Anatomically, I don't feel it quite as well because everybody's mound is a little different on their foot and so on, but, so I tend to do a little electrical searching for this one more than others.
The other thing that people should be aware of, you could be in the middle, obviously we're totally on the wrong point up on the screen, we are just playing, but notice we stopped, that didn't finish doing its reading. I can begin to find it, I can stop, I can feel comfortable, and then I can keep going with it.
Right.
So
long 9.
there's some flexibility there. Here's one other thing I'd like to teach you. So if you were, here we obviously were using the wrong points and we were just filling in any numbers because we were practicing. We have an area on here called single point exam. And I'm going to switch my exam type here, and there's nothing on the screen. And let's play with large intestine 4. If you are new to using AcuGraph and you just want to play with points, sometimes you're graphing people over and over and over again, and you're trying to compare left sides and right sides, and you're trying to get good with your pressure. Getting good with your pressure is important. Getting good with your point location is important. But here's a really great way to do it where you're not becoming frustrated by exams maybe that don't look so good. If you go to the single point exam, I'm going to go in, so I'm finding it with my finger. I can listen. There's my highest point, okay? So it showed up at 171. I'm doing it again. It went down to 167. I'm practicing being consistent with my pressure. And this isn't going to be
And there you just
exact.
flat missed the
There
point,
I
didn't you?
just flat missed it
Because you were talking.
as I was talking.
There you go.
There I am. I'm back up. So one of the things you'll want to recognize about doing this, if once you are on the right point, by the time you've measured that point 3 times, it fully loads with
It
electricity.
gets fairly saturated, yeah.
And then it begins to level out. But see, I'm comfortable. I'm learning. See, that one was a little lower. I've been learning to listen to the. See, and I'm all over the place.
Well, and you've palpated and loaded this point enough now that you've gotten it pretty hypersensitive. So you're gonna get all kinds of readings all over the map if you're not in the same place. Also, the moisture on your probe is changing. You haven't moistened
I
it in
haven't
a while.
moistened
It's
it in a
feeling
while.
dry, and it's turned blue from the marker. So that's kind of cool.
Yeah. So we suggest we'll go out of it and we'll
Beginning
come back
exam,
in.
left,
Go back
and
into the
1.
single point exam. I'm going to go to the other hand for just a second.
Okay. There it is. I think you were off a little bit before. where I'm feeling it
Mm-hmm.
is over this way just a bit.
Oh, yeah.
I think that's why it's dropping on you there. There it is. Oh, you jumped back in too quick. Let's point that out, by the way. If you don't pause for a second between readings and let it record, then you have what just happened, where it makes a sound but nothing's happening on the screen because the computer is still trying to record the last one.
Okay, so now notice I'm paying attention, I'm not talking, I'm concentrating, and I'm doing the same point over and over, and I'm getting some pretty consistent readings. So you could do that with each individual point. You could go
To
through,
learn
you
them.
could practice, and then get a feel, because measuring electrically is not something that you were taught in college, and so this is your little bit of a learning curve, and it's kind of fun to utilize this.
Perfect.
So that is
Okay.
what, if you were sitting in a
Beginning
booth with
example.
me,
Left.
That's
long
what you would
9.
teach.
this is what I would teach. We would sit down, I would palpate points. I've got many pictures of me sitting at a booth with my foot in someone's lap where I'm having them graph me and practice, and they always leave and they go, "Oh, Kimberly, thank you." So I hope that this helped you.
Nice job. Thanks, Kimberly.
You're welcome.